Deeply affected by the strikes and industrial action of the last month, the NHS continues to struggle. The UK's National Health Service, in fact, stares at the possibility of a severe shortage of staff in the future. According to a report by The Guardian, the NHS in England needs a big push of domestic doctors, nurses and health workers in order to dodge a recruitment crisis. As per an internal document accessed by the newspaper, the NHS will face staff shortages of up to 571,000 personnel by 2036. Currently, the NHS in England is already operating with a shortage of 154,000 staff members. The document, which is under a ministerial review, aims to end the crisis of understaffing of the NHS, which has been hovering over it for many years. The document warns the NHS will not be able to cope with growing demand, which is expected to rise in the future, and services in rural areas will be mostly affected, as the UK government is spending billions of dollars a year on temporary staff. It also suggests that the government should stop hiring foreign health workers. However, it looks like one of the key people opposing the implementation of the proposals is the UK Chancellor and former Health Secretary Jeremy Hunt. According to The Guardian, Hunt is combating the idea of training and increasing the number of nurses every year by 77%, as it will cost several £billion to achieve it. But Hunt's opposition is being challenged by the Health Secretary Steve Barclay as he backs the plan and points out the need to eradicate the severe staff shortages that are hampering the NHS's ability to meet waiting time targets for the likes of cancer treatment and surgery. The proposals of the document include 1,500 medical schools in the UK, 6,000 annual recruitment of GPs and a 55% rise in all types of health professionals' UK training. Well, for more on this, we're joined by our correspondent Alex Isat in London. And Alex, the NHS is suffering a chronic shortage of staff, and this report shows that the government are making some pretty significant plans to try and change that.
Well, that's what we understand. However, this problem with the NHS staffing is not a new one. And in fact, it was around before COVID as well. There just wasn't enough people trying to come into becoming an NHS staff worker, whether that's a nurse or a GP or a paramedic or an ambulance driver. Those jobs weren't being filled up. And in fact, that's one of the reasons why the strikes then are continuing to this day, is because people seem to be overworked in the jobs. They're doing crazy hours or on 0-hour contracts. They aren't able to have a work-life balance, and they are being pushed to the limit. We keep seeing these strikes, and obviously we're still hoping that no further ones will continue, as there are discussions about that pay increase that came out a couple of weeks ago. But the fact of the matter is that even if there is a small increase in funds and money to those staff that are there, people aren't looking at this as a possible job career. We have an ageing society at the moment, and as you rightly say, it's going to be the older people that are going to be looking for that care and a bit more support. And although Steve Barclay seems to be backing a campaign to change, he's also been backing a lot of this online workforce. So he wants to have these virtual wards, and he wants to increase a lot of online capabilities. However, for like an older generation, that really isn't possible right at this moment, as they are very much reliant on face-to-face services. But something does need to be done. Not that long ago, Australia was already trying to pinch some of those NHS workers from the UK and offering them huge fees and also relocation as well. But people do want to stay in the UK, so it's up to the government to try and allow those people to get a better cost of living, to be able to work, and not just to fix the gap. They need a long-term solution, and hopefully they can work together and see something through, because that's what society needs, is this NHS to be strong for everyone.
Of course, these big changes, Alex, are going to cost a lot of money. The UK tax burden at its highest level in many, many years. And do you think people would be willing to pay more taxes to potentially pay for these huge changes planned in the NHS?
Well, the tax system here, I think people are already paying out for, or they obviously are paying out for the NHS and services, and a lot of people do seem to support the NHS and the workers. When we saw those strikes, the polls kept coming back every time to suggest that people were really behind those striking. But I do think that there are a lot of people are asking, what about the other things that our taxes are going on? There's a lot of borrowing happening. We're also spending an awful lot on defence. There is a question about HS2. There's a question about other priorities that the government are putting forward. And I think a lot of the people want to see their taxes go to a benefit, like getting in extra care workers and extra doctors and extra nurses and extra staff for the NHS, because those are people that are going to be used. But I do think that a lot of the UK are asking questions about where is the rest of the money going? Are we really spending it on the right things? And that's going to be seeing a lot of people pushing back as to, you know, why are we keeping on putting on this and that when actually our NHS is crumbling, and it's been crumbling for a number of years, and COVID has brought it into the fore. People left the job because they couldn't cope, and people aren't coming back in. So it does need to have a bit of a shift around, but I don't think necessarily that the people are going to be against making sure that their NHS staff workers are getting paid right and making sure that they aren't overworked. Because I know for me personally, if I went to the doctor or to the hospital, I'd want to make sure that someone was well rested if they're going to be looking after me, and I think a lot of people feel that way too.
Alex, that's our correspondent in London. Many thanks for your insights.